Cardioversion is a medical procedure that uses an electric shock to restore a normal heart rhythm. The amount of power delivered during the procedure varies depending on the individual's size, weight, and the severity of the arrhythmia. A typical power range for low-energy cardioversion is 50 to 200 joules. For high-energy cardioversion, the range is 200 to 1200 joules. Joules measure energy while watts measure power. The conversion formula is power in watts equals energy in joules divided by time in seconds. The electric shock is typically delivered in a matter of milliseconds. For example, a typical shock of 200 joules delivered in 5 milliseconds would result in the following power. Power in watts equals 200 joules divided by 0.5 seconds, which equals 40,000 watts. The values provided are approximate and may vary depending on the specific equipment and settings used. The power delivered is carefully calibrated and monitored to minimize the risk of complications. The calculation highlights how much power is briefly applied during cardioversion. The short duration is key because power is the rate at which energy is transferred or used. A high power value sustained for a long time would be dangerous, but the brief pulse minimizes the risk. Electrical safety is paramount in medical procedures. The equipment used in cardioversion is designed with multiple layers of protection to prevent unintended shocks to both the patient and medical personnel. Firstly, the device itself is rigorously tested and calibrated to ensure accurate energy delivery. Secondly, the paddles or electrodes used to deliver the shock are insulated to prevent current leakage. Thirdly, healthcare providers are trained to follow strict protocols, including using proper hand placement and ensuring that everyone is clear of the patient before the shock is administered. The process starts with monitoring the patient's heart rhythm using an electrocardiogram or EKG. The EKG displays the electrical activity of the heart, allowing medical professionals to identify any abnormalities such as atrial fibrillation, atrial flutter, or ventricular tachycardia. Once an arrhythmia is confirmed and cardioversion is deemed necessary, the medical team prepares the equipment. This involves selecting the appropriate energy level based on the patient's condition and the type of arrhythmia. The energy level is measured in joules, which represents the amount of electrical energy delivered to the heart. Next, the paddles or electrodes are coated with a conductive gel to ensure good contact with the skin. Proper placement of the paddles is crucial for directing the electrical current through the heart. The most common placement is one paddle on the upper right chest, below the collarbone, and the other on the lower left chest, near the apex of the heart. Once the paddles are in place, the medical team announces a warning, such as clear, to ensure that no one is touching the patient or the bed. This is to prevent accidental electrical shocks to anyone in the vicinity. The cardioversion device is then activated, delivering a controlled electrical shock to the heart. The shock depolarizes the heart muscle, disrupting the abnormal electrical circuits that are causing the arrhythmia. Ideally, this allows the heart's natural pacemaker, the sinoatrial or SA node, to regain control and restore a normal heart rhythm. After the shock is delivered, the EKG is immediately checked to assess the heart rhythm. If the first shock is unsuccessful, the energy level may be increased for subsequent shocks. In some cases, medication may be administered to help stabilize the heart rhythm. Throughout the entire procedure, the patient's vital signs, including heart rate, blood pressure, and oxygen saturation, are closely monitored. This allows the medical team to quickly identify and address any potential complications. Cardioversion is typically performed under sedation to minimize discomfort for the patient. The level of sedation can range from mild to deep, depending on the patient's condition and the preferences of the medical team. After the procedure, the patient is closely monitored for a period of time to ensure that the heart rhythm remains stable and that there are no adverse effects from the electrical shock. The duration of monitoring can vary depending on the individual patient and the specific circumstances of the procedure. While cardioversion is generally a safe and effective procedure, there are some potential risks and complications. These can include skin burns from the paddles, blood clots, and, in rare cases, more serious complications such as stroke or heart attack. However, the benefits of restoring a normal heart rhythm usually outweigh the risks. It's important to remember that cardioversion is just one part of a comprehensive treatment plan for arrhythmias. Depending on the underlying cause of the arrhythmia, other treatments may be necessary, such as medication, lifestyle changes, or more invasive procedures like ablation or pacemaker implantation. The risks associated with cardioversion are relatively low, especially when performed by experienced medical professionals in a controlled setting. The most common side effects are skin irritation or minor burns at the site of the paddles or electrodes. These usually heal quickly and can be minimized by using proper technique and skin protection. More serious complications, such as blood clots or stroke, are rare but possible. To reduce these risks, patients are often given blood-thinning medication before and after the procedure. In very rare cases, cardioversion can cause more serious arrhythmia or even cardiac arrest. However, these events are extremely uncommon and the medical team is prepared to handle them if they occur. The decision to perform cardioversion is based on a careful assessment of the patient's condition, the type of arrhythmia, and the potential benefits and risks of the procedure. Patients are typically informed about the procedure and its potential risks and benefits before giving their consent. Alternative treatments for arrhythmias include medication, such as antiarrhythmic drugs, which can help control the heart rhythm. However, these medications are not always effective and can have side effects. Another option is ablation, which involves using catheters to destroy the abnormal electrical pathways in the heart that are causing the arrhythmia. Ablation is a more invasive procedure than cardioversion, but it can be more effective in certain cases. In some cases, a pacemaker or implantable cardioverter defibrillator, or ICD, may be implanted to regulate the heart rhythm and prevent life-threatening arrhythmias. The choice of treatment depends on the individual patient and the specific type of arrhythmia. The energy levels used in cardioversion are carefully selected based on the patient's weight, the type of arrhythmia, and other factors. The goal is to deliver enough energy to depolarize the heart muscle and restore a normal rhythm, while minimizing the risk of complications. The energy levels are typically adjusted based on the patient's response to the initial shock. If the first shock is unsuccessful, the energy level may be increased for subsequent shocks. The medical team also monitors the patient's EKG and vital signs to ensure that the energy level is appropriate and that the patient is tolerating the procedure well. There are different types of cardioversion, including synchronized and unsynchronized cardioversion. Synchronized cardioversion is used for arrhythmias that have a regular pattern, such as atrial fibrillation or atrial flutter. In synchronized cardioversion, the electrical shock is delivered at a specific point in the heart's electrical cycle, which helps to prevent the shock from triggering a more dangerous arrhythmia. Unsynchronized cardioversion, also known as defibrillation, is used for life-threatening arrhythmias such as ventricular fibrillation, where the heart is quivering and not pumping blood effectively. In unsynchronized cardioversion, the electrical shock is delivered immediately, without regard to the heart's electrical cycle. The most important aspect of cardioversion is that it is a potentially life-saving procedure that can quickly restore a normal heart rhythm in patients with dangerous arrhythmias. While there are some risks associated with the procedure, they are generally low and the benefits usually outweigh the risks. Cardioversion is an important tool in the management of heart rhythm disorders and can significantly improve the quality of life for patients with arrhythmias. In addition to the technical aspects of cardioversion, there is also a human element. Patients undergoing cardioversion may be anxious or fearful about the procedure. It is important for the medical team to provide reassurance and support to help patients feel comfortable and confident. The medical team should also explain the procedure in detail and answer any questions that the patient may have. This can help to reduce anxiety and improve the patient's overall experience. After cardioversion, patients may need to make lifestyle changes to help prevent future arrhythmias. These changes may include quitting smoking, reducing alcohol consumption, and maintaining a healthy weight. Patients may also need to take medication to control their heart rhythm and prevent blood clots. Regular follow-up appointments with a cardiologist are important to monitor the patient's condition and adjust treatment as needed. Cardioversion is a complex medical procedure that requires specialized training and equipment. It is typically performed in a hospital or clinic setting by a team of medical professionals, including doctors, nurses, and technicians. The medical team works together to ensure that the procedure is performed safely and effectively and that the patient receives the best possible care. Furthermore, the advancement in technology has helped to improve the safety and effectiveness of cardioversion. Newer devices have more precise energy delivery and monitoring capabilities, which can help to reduce the risk of complications. Research is also ongoing to develop new and improved techniques for cardioversion. Cardioversion is a constantly evolving field, and medical professionals are always striving to improve the procedure and make it safer and more effective for patients. The specific type of cardioversion used depends on the type of arrhythmia being treated. For example, atrial fibrillation, a common arrhythmia characterized by rapid and irregular heartbeat, is often treated with synchronized cardioversion. Ventricular tachycardia, a more serious arrhythmia characterized by a rapid heartbeat originating in the ventricles, may require unsynchronized cardioversion or defibrillation. The decision of which type of cardioversion to use is made by the medical team based on the patient's individual condition and the specific characteristics of the arrhythmia. Cardioversion is often used in conjunction with other treatments for arrhythmias. For example, patients with atrial fibrillation may also be treated with medication to control their heart rate and prevent blood clots. In some cases, cardioversion may be used to restore normal heart rhythm before a more definitive treatment, such as ablation, is performed. The medical team will develop a comprehensive treatment plan based on the patient's individual needs and goals. In summary, cardioversion is a valuable tool in the management of heart rhythm disorders. It is a relatively safe and effective procedure that can quickly restore a normal heart rhythm in patients with dangerous arrhythmias. The procedure involves delivering a controlled electrical shock to the heart, which depolarizes the heart muscle and allows the heart's natural pacemaker to regain control. While there are some risks associated with the procedure, they are generally low and the benefits usually outweigh the risks. Cardioversion is an important part of a comprehensive treatment plan for arrhythmias and can significantly improve the quality of life for patients with heart rhythm disorders. It's also beneficial for the medical community to document and share their experiences with cardioversion in medical literature and at conferences. This allows other medical professionals to learn from their experiences and improve their own techniques. Sharing best practices can help to reduce the risk of complications and improve the overall outcomes for patients undergoing cardioversion. Continuing education and training are also essential for medical professionals who perform cardioversion. This ensures that they stay up to date on the latest techniques and technologies and that they are competent in performing the procedure safely and effectively. Regular training can also help to improve their skills in managing potential complications and providing the best possible care for their patients. The power formula is the relationship between power, energy, and time, emphasizing the short duration of the shock. Electrical safety is critical because the equipment is designed with safety features, and medical personnel are well trained.